Hello, greetings, comrades. We are sharing a very important discussion today. I'm Nicholas Marvin Ahumuza. I'm a public health specialist who has a background training in clinical medicine and community health. Besides me, I have
I'm Grace, and I'm an enrolled nurse.
Yes.
Afiel Sarah, and I'm a clinic officer.
Thank you so much. This is Icon Medical Center, located in Bulenga, Metiana Road, just right away from Busega. So today we are taking you through menstrual hygiene. When we talk about menstrual hygiene, basically we are talking about what should be done during the menstruation period. So, number one, we have to look at what it is. What is menstrual hygiene? When we talk about the menstrual hygiene, we are basically looking at, is there easy access of the menstrual materials to use? Do females have privacy while using them? And can they access facilities where these used sanitary pads can be discarded? So basically that is what we are looking at. Most of the people only just look at getting a sanitary pad, getting a tampon, getting this and using it. But menstrual hygiene goes far beyond. Most of the question that people ask or people want to know is, at what age do they expect the menstruation to start? And at what age do they expect it to stop? The simple response to that is that we expect our females to always start menstruation almost around 8 to 12 years. Have a young daughter at home who experiences kind of menstruation in quotes, which is below 8 years. We call that pre-puberty, and you may need to see a doctor to advise further, because we expect the menstrual flow to start at 8 years. Anything below that, you need to find your nearest doctor and inquire or discuss more about that. Next, when do we expect this to stop? We expect this to stop up to 49 years. However, some females can still experience menstruation above 50 years. But if it is going above 50 years still, it should be early 50s, but not late 50s. If it is going beyond early 50s and you are still experiencing your menstruation within the late 50s, it could be a probable gynecological condition that you may need to see your nearest doctor, or you may need to see your nearest gynecologist. These days we have very many causes. We may call it abnormal uterine bleeding, of which a cancer could be part, endometrial cancer, cervical cancers. They are at rise, fibroids and other not. So if you are experiencing your menstrual flow in the late 50s and above, please go and check on your nearest doctor for further discussion about that. So we expect menstrual flow basically to be in the reproductive age. But when we talk about the reproductive age for females, basically we are talking about 15 to 49 years. However, for menstruation, we've said from 8 years, we expect that our young daughters at home could have started their menstruation. Our next big concern should be, what do we use? You remember, to recap the definition of menstrual hygiene, we talked about something like our females who are undergoing menstruation should be able to access, should be able to afford the materials to use while having or while undergoing their menstruation period. Okay, so in this is where we look at what materials do we expect people to use when they are experiencing their menstruation. Or you, the mother who is at home, and your first daughter probably is about to have started experiencing menstruation. What do you need to put in store? For mothers, this is not a challenge, because probably they have also had the same experience before and they may know what to do. But also they may need to be reminded, or even the daughters. One of the biggest challenges we are having today is that some daughters or some girls are not staying with their parents. So themselves, they need to have some of this information, because you cannot rely on a parent. These days, because of the education, because of work, the girls are at school, the girls are at work, the girls are far away from parents, and they may not access the right information from their mothers who have had experience in this, and they may themselves need to know. So our viewers, we have a sample of the materials we expect females to use during their menstruation period. And number one, we may just have a menstrual cloth. A menstrual cloth is whereby someone can just use a piece of cloth, okay, to absorb or to prevent the obvious flow. So a piece of cloth is used to absorb the menstrual blood, and in this it will also keep, or it will also promote the menstrual hygiene. Someone may not use a cloth or the menstrual cloth, but may use a reusable sanitary pad. We have a reusable sanitary pad. A reusable sanitary pad, these are special pads that are made, and they are over market in supermarkets, in pharmacies, hospitals, clinics. You can find them everywhere. These are reusable pads that will allow someone, even after using this sanitary pad, someone can clean it, keep it, and use it in the next floor. However, we advise that if you are using the reusable sanitary pads, you must probably wash them clean, or you must boil them in hot water so that we can clean, or we may destroy the bacteria, the fungal, the virus, or the all microorganisms that may be embedded within it. These are the reusable sanitary pads. Interestingly, we have the disposable. We have the disposable sanitary pads. These are the most we normally recommend, because for cost-effective issues or for financial constraints, some people may find it hopeful to use reusable sanitary pads. But when we look at the health aspect of it, we normally encourage disposable sanitary pads, because we presume or we know that after using them, once they are discarded, it is better. Which one would you prefer? A disposable sanitary pad and a reusable sanitary pad, out of experience?
Me, I would prefer a disposable.
A disposable,
because most
yes.
of the times the reusable ones, so some people don't know how to clean them.
That is
Then
interesting.
That exposes them to infections.
Thank you so much. You're learning from the best experience. Someone who is a medical professional, and there's sometime who is a female medical professional. What about your take?
I also take the same.
Okay.
Yeah, because these reusable ones, sometimes some people even fear seeing their blood. So telling them that to wash them may be kind of disturbing to them.
Thank you so much. That is really a very key point. And through this, when we deliberate them more, then we can really conquer that a disposable sanitary pad could be better. We can also look at, there are very many materials we can use. For example, you can even use, there's what we call a menstrual cup. I know this may sound funny, or it may sound new to some people for the menstrual cup. Some people are not used to them, and they also have their challenges. Okay, so a menstrual cup is it is like a bell-shaped. It's like a bell-shaped. If you know, these bells we ring at school, especially in primary schools and all that now. So these are bell-shaped cups that females have to insert into their vagina. So when they insert them, for them, they don't absorb the blood, but they collect. So the sanitary pads and all that, they have been absorbing blood, but these cups, or the menstrual cups, they collect blood. And after collection, then they can be removed, and they can be emptied, then they can be washed and cleaned, then they can be used in the due course. So these are the menstrual cups. They are also the materials we can use. The last we have what we call a tampon. A tampon is normally, we normally find it in more civilized people, in most of the elites, because most of our local people don't know even about the tampons, because they are even normally found in the high-income countries or developed countries, or even when you come to our countries like Uganda, you may find them in more elites and civilized females. So tampons may also look, or they may also seem rare to most of our big population that may be centered in the local areas. But a tampon is something you insert also into the vagina, or you insert into your genital, and it goes deep inside. So once it goes deep inside, some of them, they have some kind of like a string that is attached to it, which someone can use to pull it out. Most of the questions, or what people are interested in, they are always interested in, after how long should we change our sanitary pad? After how long should we remove the tampon? After how long should we remove the menstrual bell? This is a very sensitive part, because I've seen, personally, I've received females, and when I try to be inquisitive asking them about their menstrual hygiene, this is someone who will tell you, I put on a sanitary pad from morning to evening. I put on a sanitary pad for the whole day. This is unhealthy. It is unacceptable, because you are risking your health, because you are allowing microorganisms to culture, you are allowing them to multiply further, and this is very unhealthy to you. We recommend
that, for example, a menstrual cloth, if you are using a menstrual cloth, we are saying this is someone who has made the cotton cloth and decides to use it. We advise that you should use it probably between 2 to 4 hours. When we talk about a reusable sanitary pad, for a reusable sanitary pad, we normally recommend that between 3 to 6 hours we should have our reusable sanitary pad changed. This gives us also a clue that when you are using a reusable sanitary pad, you don't need to have one, however much it is reusable, because we have to allow time for cleaning the sanitary pad you've used to the next time. So if you have one, then we are going to have challenges. It is the same time like you use the knickers. We don't advise that you should have one knicker. Because if you're having one knicker, it means, or having one underpart, it means when you clean it, you don't have any other to use during the between time you have cleaned and you are awaiting for the next use. Okay, we can talk about the disposable. The disposable still the same. We advise that between 3 to 6 have it changed. For the interest of time, you will allow us try to rush you and maybe go to the menstrual cup. Remember, we said the menstrual cup does not absorb but collects. So because for it collects, it can be used for an extended period of time. And we advise that it should be changed, or it should be taken out between probably 6 to 12 hours. So you can use it 6 hourly or you can use it 12 hourly. Lastly, we are talking about a tampon. So a tampon, when we are talking about the tampons, for them, we restrict them to a maximum of 8 hours. It is up to you. You can remove it before 8 hours elapse, but to a maximum, you should not use a tampon, you should not insert a tampon before 8 hours.